Hey friends, I'm so glad you found me. I'm Stephanie Carter Kelly, a physical therapist that uses yoga in almost everything that I do. Today we're talking about support of your spine, and we're going to go over the anatomy of your spine. I'm going to talk about the amazing design that has so many backup ways to support you if something fails. My hope is that the understanding of anatomy will help you decrease your fear. I have so many clients that when they first start taking yoga with me, they come and they say, I have this pathology or this pathology of my back. And I can see that they're scared to start. And I assure them that it's okay, that we're going to take care of them. But it's also because I know how much support is in their spine. And I know that starting a program of movement and strengthening is going to just enhance all that support of the spine. The other thing is that it helps, looking at this anatomy helps you focus on the positive aspects of your spine. And I want you to think about how that relates to your life. So many of us focus on that negative. Our brains are actually wired to focus on the negative as a survival mechanism. The research shows if you start a gratitude journal and you just write down 3 things that you are grateful for every day, that you can really change your outlook on your life and start focusing on the more positive aspects of your life. And so I'm going to show you the anatomy so that you can look and focus on those positive things in your spine that you know you can change. So many of us think that once we have this pathology in the back that we can't change it. But there are so many things that you can change that help give you that support. So let's take a look at the anatomy.
So this is our female anatomy specimen. I'll just show you. Yes, it's a female. And we're going to start with the muscular support of the front of the body. So just to give you a little bit of orientation, I'm going to draw here just a little bit. This is the shelf of the pelvis. On each side, the ribs are right about here. And so we're really going to focus in on this lumbar spine area and look at all of the support that is in this lumbar spine area. So first I wanted to just orient you to the colors. This color in our muscular system, this white, is just really thick connective tissue. And that connective tissue, it's not contractile and it's not very stretchy. It's thick and it provides a lot of support in the area. The red or pink then is the muscle. And so we're going to look at both of these and think about the support of the muscles, the tissue, and then we'll get down to the ligaments and how they all support this whole area. So in the front of the body, we're looking at the abdominal muscles. And so this white along the center of the body is the sheath, we call it, that encases the rectus abdominis. And this big red muscle that comes in here on the side, look at how far it goes to the side. It's all the way into the side of the body. That is external oblique. And so one by one, we're going to take away these muscles so that you can see what's going on. So now we've gotten rid of the sheath, and you can see rectus abdominis in this sheath. And know that this sheath also wraps around behind rectus abdominis, and other muscles are then going to attach into this very thick connective tissue. So that's rectus abdominis. It really is the most superficial muscle in the front of the body. And then we have that big external oblique. We can see it on this side. It kind of really covers that whole side of the body from the chest all the way down to the rim of the pelvis. So let's take away rectus abdominis, and underneath it, we're going to see internal oblique, again, still all the way out to the waistline or the sides of the body, down to the pelvis, up to the ribs, internal oblique, and beneath that is transversus abdominis. It goes the whole front of the body all the way around, wrapping into, and we'll talk about this other big area of connective tissue in the back of the body. So transversus abdominis, internal oblique, and external oblique really form this corset wrapping around the whole entire waistline and above and below. So let's look at then the back of the body. I'm going to get a little bit closer in here. So again, this really thick connective tissue in the back of the body. And just to orient you again, shelf of the pelvis on each side, rib cage is right around here. These are the ribs. So again, we're going to focus in on that low back area. We'll also talk some down low. Let me get rid of this. Down low, this is where your sacrum is. I always call it this sort of triangle, rhombus. I'm not sure what this shape is, but that's where the sacrum sits, wedged down into the pelvis, and we'll give you a better picture of that in a minute. So notice how the muscles from the arms, from the upper torso, this is the lat, the latissimus dorsi, it comes all the way in and connects into that very thick tissue. And so beneath that, then, we have more of our lumbar muscles. I'm going to get rid of this middle muscle, serratus posterior inferior, and let's take a better look here at this lumbar spine. I want you to recognize, though, that these lumbar muscles run the whole length all the way up into the mid-back. That's longissimus thoracis. And then the next one out is iliocostalis lumborum, big strap-like muscles. So if you're contracting muscles, up around the shoulder blades, below the shoulder blades to backward bend, you're getting these muscles to contract. And then we go even deeper, and down deep is the multifidus, big, thick muscle, really deep into the spine. So we are in the lumbar spine now. We have the fascia, we've got 3 muscles deep, lots of layers of support. We can't even see the vertebrae yet. Okay, there they are. We took the multifidus away. Now we can see the lumbar vertebra. We're getting even closer in just so you can get a good picture of what's going on here. We can get rid of the lat on that side. And so I'm going to get rid of, remember we talked about the abdominal muscles wrapping around? That's external oblique in the back side of the body. Here's internal oblique on the back side of the body, and transversus abdominis on the back side of the body. So they wrap all the way around to support the back of the body. Another big muscle down deep in the low back is quadratus lumborum. Big, thick muscle, more out to the side, not in the center of the spine, but out to the side. And then we have, when you see these little tiny muscles are sensory organs. They sense the position and movement of the spine and send that information up to the brain. So little tiny muscles probably are going to do more sensory than actual creating movement. This is spinalis. It's in the upper part of the lumbar spine. Another lumbar muscle, intertransversare. It goes between the transverse processes to hold everything together, nice and stable. Support. We're interested in how much support the muscles provide into this low back region. So we had 4 muscles of the abdominal region. Now we are 1, 2, 3, 4, 5, 6, 7. I don't even know. We're so many layers deep into muscles of the lumbar spine. And realizing that we can improve the support of the spine when we strengthen these muscles. Okay, so this big muscle, we still see a lot of red here, all around the spine. This is now in the front of kind of on the side or the front of the spine, attaches to the front of the vertebral bodies, we call them. Maybe you have heard of psoas. So the psoas muscle comes from the spine, crosses over that SI joint, joins up with another muscle in the hip, and goes all the way down to the femur, crosses the hip joint. So psoas major, psoas minor. One other thing I want to show you about this area, and then we're going to get into the ligaments, is I want you to look at the diaphragm. So we're going to look up into, this is where the lungs would sit, this whole umbrella-like structure. If we think about it being up underneath the ribs, this umbrella-like structure is the diaphragm. And the diaphragm, look how far it comes down. It comes down and attaches onto the lumbar vertebrae. Looks like 3, 2, 1. 3, 2, 1 of the lumbar vertebra. So the diaphragm is even supporting the upper portion of that lumbar spine. Okay, so I'm going to take away now all of the muscles so that we can look at just the ligaments. Okay, now we're down to ligaments. We're going to get even closer, really deep. We're going to start in the front of the body, come back to the front of the body. So this big ligament runs all the way up and down the spine. If you look at it, we can pull back. It goes all the way up, even to the front of the neck. That is the anterior longitudinal ligament. Provides lots of support in the front of the spine. Now we're going to go around to the, we'll stay right here in the front so that you can take a look at the ligaments that support the front of the SI joint, the anterior sacroiliac ligament. This ligament provides support. It holds this L4 lumbar vertebra, L5 lumbar vertebra down onto the pelvis. It gives it some force down so things stay nice and stable. Again, these little skinny ligaments are probably more sensory in nature than they are supportive. They're sending more information up to the brain so that the brain can tell where the low back is in space. So we'll get rid of that one. We'll get rid of this one out on the very tip or the very end, supraspinous ligament, but it goes all the way down to give that information up to the brain. So let's go deep. So this is the back of the vertebra. I want to get in close here so I can show you the joint structures. I'm going to draw on this. So this is a joint of the low back. This is a joint of the low back. This is a joint of the low back. Those are all the joints of the low back. I want you to also look at the SI joint, the sacroiliac joint. That is where the sacrum gets wedged down inside the pelvis. It does not have a uniform shape because it's not supposed to move very much. It really is wedged down in there. Can it move? Maybe a little bit, but it's very well supported by ligaments, and it has an irregular shape so that it stays nice and stable. Let's look at this ligament. It runs sort of on the back side of all of the joints. It is called the ligamenta flava in the lumbar region. Nice, you can see it's nice and wide, providing lots of support in that area. And then we've got another one. The posterior longitudinal ligament runs along the back side of the vertebra, right along the body of the vertebra, and also along the back side of the intervertebral disc. So even that disc has extra support in the front, anterior longitudinal ligament, and in the back, the posterior longitudinal ligament. So it's got lots of support. So we're going to take a look at the disc next, but I want to orient you to what we're going to look at. So we'll just kind of pull this guy around. So each one of these is the disc. The gray represents the fact that this is a lot like ligament. And so it's ligamentous material attaching the bottom of one vertebra to the top of another vertebra. And we're going to zoom in and look really carefully at the disc between L5, the lowest lumbar vertebra, and the top of the sacrum, and sometimes that's called S1, S for sacrum, and that the top of it is the first sacral vertebra. So we're going to go closer. So this is what your disc looks like, and you'll notice some crisscrossing of fibers. So the outer layers of the disc is called the annulus fibrosus. And the annulus fibrosus has concentric rings of ligaments that goes in all different directions. So we'll pull it around to the front. So you can see that this layer is going in this direction. So if the vertebra above it turns and twists, say to the left, this part of the annulus fibrosus is going to tighten up. If the vertebra above turns to the right, then these fibers of the annulus fibrosus are going to tighten up. Same thing if it side bends to one side or flexes and extends, different parts, different layers of the disc is going to tighten up and restrict that movement. And so there are many, many layers of this connective tissue, of this ligamentous material in the disc until you get to the center of the disc. There can be up to 20 layers. This only shows us 1, 2, 3, 4-ish. So it's showing us 4 layers. Most people have anywhere from 10 to 20 layers of annulus fibrosus. So lots of support of a disc. So even when you hear diagnoses of disc bulging or disc tearing or disc rupturing, you still have lots of layers that can support those injuries, and this also heals. Just like any other ligament, this is going to heal. So what is the center portion? The center portion is called the nucleus pulposus, and it is a gel-like substance. When we are younger, it dries out as we get older, but that gel-like substance then helps to provide shock absorption between the vertebra above and the vertebra below. So that's what gives us a little bit of shock absorption. So I just wanted to show you all of the layers of support that you have in your back.
Again, my hope is that a better understanding of the layers of muscles and ligaments in your back help give you a positive outlook on your spine in a new way so that you can decrease the fear and increase your understanding of all the support that you have. And also take a look around and look at all of the support that you have, both internally, by what you say to yourself, but also look externally for those people that support you, your family, your friends, your colleagues that are supporting you to give you a better life each and every day. So if you like this video, share it, subscribe to my channel, and hit the bell so that each week you can get more information about how to use physical, mental, and spiritual ways to heal your pain. I'm Stephanie Carter Kelly, yoga physical therapist. Namaste.